My name is Richardson, and I've been the first director of SZV from 2010 to 2012.
My name is Reginald Willemsberg, and I was director from 2012 to December 2014.
My name is Glen Carty, and I'm the director from December the 1st, 2014 to present.
Great, thank you.
What emotion comes to mind by me is, how did it go so fast? It's 10 years. It's like yesterday I was in the board of SZV working with my good friend Dennis, and in such a short period of time, 10 years has passed. How do I feel about it? I'm very proud for the simple fact that St. Maarten, and I guess we'll be hearing more from you on that, Dennis, is cutting over from the former Netherlands Antilles SVB into an organization like SZV, and I've been proud to be part of that history and making.
My feeling is a sense of pride because, in my opinion, the taking over of the responsibilities for social insurances by St. Maarten in the form of the SZV has proven in the end to be the right move, the right thing to do. There were proposals to keep it for a number of years by QSAR, but we decided that we would take over the whole operation, and that has been positive. It's been positive in the sense of finances, because as it turned out, with the division of assets and liabilities, we were on the positive side. Millions and millions of euros came to St. Maarten for that. It was positive in the sense that our government did not decide to take those billions and use it on a daily basis for normal government operations, but to leave the money in SZV so that it could carry out its responsibilities towards the insured. They also insured on the annual age pensions. And it is positive because in the end we've been able to prove that we can carry out the tasks and responsibilities that goes with it, that the capacity within St. Maarten was there to do it gradually, actually, but we did prove that we could do it, and it gives me a sense of we can do that we had in those days that seems to be confirmed.
Well, I can say that I can join you, Dennis, and say that yes, I feel proud because especially when we were overwhelmed in the beginning, because we all of a sudden you hear from one day to the other, we were confronted with a situation that there's a new organization and should we take over, yes or no? And I was glad to be part of that decision-making process together with you when we decided, listen, we're going for it. With the limited resources that we had, we did it. And as we have proven, because a lot of people were keeping their fingers crossed to hope that we may fail, but we have shown that we could have done it with the limited resources, and what was for me was so great is that we took not only the SVB, but we had at that time the SZV also. We took them together, bring two different groups of people, two different cultures and everything, bring it together, mesh it to do it right, and all of a sudden we had our own fate in our hands, so that we started plotting the direction that the organization had to go, while before that, the Netherlands Antilles, all decisions were taken in Curacao. And all of a sudden, we were confronted, we started taking decisions that were to the benefit of not only the organization, but of St. Maarten. And I think that is something that was a great achievement, that together with the staff we had at that time, and slowly but surely with the new staff that came in, that we have reached this great milestone of 10 years. And like Glenn said, yes, it was like yesterday we started and we're here now.
But Ricky, you were pre-SZV, you were from SZV time. How many staff did you have then, and what was done in Curacao in those days?
Well, at that time we had, before 10-10-10, we had a situation that St. Maarten was the branch for and had office for the Wimmer Islands. So you had Sabre Station at St. Maarten. We had two persons, one person in Sabre, one in Station. And here we had in the SVB office, we had in total 32 persons. Then we had, if you take the base at V staff, they were about 8 persons that came along. So basically, in that at that time, we had a maximum about 39 persons in service. And what we didn't have was all the support services that was headquarters in Curacao.
Yeah.
Legal, the financial department, all the policies were being made in Curacao, all the decisions, the big decisions were being made in Curacao. Here, St. Maarten, we were only like a branch, like a window. So we used to take information, send to Curacao, and decision was being taken there
And sent back up.
and sent back up. And of course, that had an effect that on a day-to-day basis, that a lot of things, decisions were taken based on the situation in Curacao, while the situation in St. Maarten is completely different. We have a different culture, a different mix of the population compared to Curacao. So it's for example, here we had 75% of the population was non-national, non-Dutch, non-St. Maarten born, and while in Curacao you have 75% are Curaçaoians born there. So that makes an effect that you have to talk different languages. You have to understand the way the people think for you to be able to do it. So that's why it was quite an achievement for us to be able to reach where we are right now.
We have taken over here since Dennis and Ricky have made a transition from SVB to SZV, and we went then from 39 employees to today I think close to 110 employees, because we have taken all the back office, all the legal departments, the local decision, everything is made. We're still in a journey. SZV is pretty, I would say pretty far from where we still have to be. I'll get into that a little bit later. But we are building on what these two gentlemen started to do, and we are busy with that process. And that process is still ongoing. But in just a while, I will explain you where my vision is, and we can talk about that, of where I would like to see SZV, especially now since the world has changed with the corona situation, since St. Maarten has changed with the corona. We came out with SZV 3.0. It's well known in the community, and 3.0 is customer service orientation, customer driven. We have the monopoly in what we do, and it doesn't because we have the monopoly that we have to treat our customers in such a way that you have no other choice than to come to us. So the whole culture aspect of SZV has to change from a kind of say a civil service mentality into more a service-oriented organization. And that's the challenge we have. I'm very proud of my staff. We have a very, very good staff. They have to work under sometimes difficult conditions, especially now with the COVID. But that is a journey we're on, and we're definite that we will achieve that final goal.
From my perspective, the transformation of SZV from how it was when I started has been tremendous. I remember that not only the challenge of building an organization that can take over the tasks and responsibilities that were then in Curacao was one of the big challenges, but simple things like long lines of people from early in the morning waiting outside of the building to get the service. Those transformations were necessary and urgent as well. So you have to be walking on two paths. On the one part, the structure and the future of the organization. Another part, normal operational things that have to be taken care of in a way that would benefit the community. And sometimes we forget how many things have changed compared to when we started. That is in general with 10-10-10. The impression that we have today is that it's not much has changed, but that is not true. If you really go back in time to before 10, and could follow that thread, you will see that tremendous changes have taken place. The problem we have is that with changes, it never stops because the community changes, the demands go up.
And that's a good point that you brought up. Our customer age is shifting. We are now getting a younger, more tech-savvy customer to deal with. They don't want lines. They don't even want to come here. Right now, with COVID, we don't want them to come here actually. But it is a different breed of customer that, it's 10 years ago, but a customer that was 14 years today or 15 years today is a customer that was 0 years in your days.
Yeah.
So, and those are actually walking in with their parents right now and expecting to get that particular service or to do it online. So you're right when it comes to that.
In the first place, I believe that the way it was organized, it was de facto QSO, it was the Netherlands until really, but the de facto QSO, brought a lot of problems for the customers here in Sint Maarten, service-wise. They lacked an understanding of the specific situation that Sint Maarten is in, as Ricky just described. You have a different population with many different languages and not even with sufficient understanding of our laws. And then to service those customers with limited means that were made available, and the decisions being taken far away from Sint Maarten, therefore not taking the local situation into consideration, I would say that the customers had, in their opinion, a not so positive view of SZV, because it was SZV really in those days. When we took over, it was changed into SZV. So a lot of things had to change, and that was and all of that had to happen at the same time. And naturally, that is not possible, especially if you have limited means. So it took some time to really be very clear. But the transformation of the organization since then has been tremendous. I remember us now in those days talking about telemedicine. Give an example. It's still not there, but it's still on the books, as it were. That and with the takeover of information technology and telecommunications in addressing customers and servicing customers, that change will have to take place under the present director, my good friend Glen, or a future director, depending on the investments we have to make that possible. But it is, from my perspective, major changes have taken place, and notwithstanding that the fact that there could be more improvements, I think that it is an example of a success story in Sint Maarten as far as the change 10 is concerned. It kind of embodies the aspects that you look for when you speak of autonomy. The possibility to take decisions about yourself under the circumstances that you are in as Sint Maarten, and not being related to something that is in future that has absolutely no point of reference for yourself. So from that point of view, I think we are on the right track.
I think we are governed by laws, and we're governed by policies that we determine ourselves. You have, on one side you have the laws, on the other side you have the internal procedures. And again, I think where we have to improve on is to educate our customer. Very often you see negative information on the blogs, or you see so-called news agencies coming out with information or their way of visualizing SZV. And it is because of the lack of understanding on how it works. So that is where SZV definitely has to improve on, is by educating our customers and educating the population. Another thing that we have to look at that is, and Ricky, I don't know what you think about that, laws that date back. I mean, times have changed, but laws have not changed, and things have changed. And this is also where SZV is embarking on advising government to change the laws, scratch some laws, come with new laws, to do that and make it simpler. Big discussion about the national health insurance, national general insurance. That is something we keep on postponing, but that is something we have to sit down and discuss and talk and make those decisions, make SZV sustainable also. Healthcare is a very, very expensive part that SZV pays out, of course, which is, I think, pre-COVID, 150 million guilders a year. That's local and referrals. And again, with all this information going around, all the lack of understanding of how the laws work, different funds for depending on how you're insured. So I think SZV has to improve. We have done a lot already when it comes to communication. We have actually a communication department. We have to improve informing our customers and educating our customers. And that is the sometimes when you see things, they say, but that's not the way it is. It's a misinterpretation of what they think they should get or not get.
I think adding to that, Glenn, I think also what is a misconception is the part of people when they hear social, they feel that SZV is supposed to resolve all the social problems. But the social is not really social in that sense. We're not social affairs. We are talking about the social is more part of the the solidarity as to how do we cover the medical insurance, the old age for cases when the people who need it most, that we share pool the risk that exists. And a lot of times when you, and one thing I could tell you, I think you would agree with me that in St. Maarten have a lot of people hurting. And when people hurt, they're looking for somewhere to help them. And sometimes that place that they look at is SZV. Now there's certain things we can do. Yes, if you have to be sent away, yes, we can refer you abroad. If you need medication, yeah, that is covered. But the other social ills that exist in St. Maarten, people expect that we can resolve it, and sometimes, although you would be willing and would like to be able to help people in those situations, it's a challenge, and what we have learned through the last few years is how do we go that extra mile to help people, to find if we can help them, to at least to guide them where they can go to get the necessary help.
Well, that is one of the main factors behind the SZV 3.0. When someone comes in with an issue, that we don't just say, no, sorry, we can't do it. We point them in the direction that they would be able to go. That customer, with that extra mile, as you call it, that customer satisfaction, that is what we're trying to instill into our staff to be able to do that. But for us to be able to do that, we need to know exactly how it works, because while I can't, keep my staff responsible for not being able to give an answer, but that is the knowledge that we need to have internally also to know where to send that person to, because maybe it might be social services, stuff like that. So that is what we have to improve on and continue to upgrade. You mentioned just now information, communication, education. I think that in the 6 years I've been here as director, I've been here actually with Dennis Enrique as one of the first board members in 2010. So I joined the team in 2010. I was supposed to be director for a period of 3 months. That lasted and is still lasting 6 years. And what I can tell myself is more communication to the staff, more communication to our customers, to move away from that misconception of not knowing exactly what SZV does, where you have to go, what forms you have to fill in. But we have to modernize. So in other words, we need to make it simpler. If I can bring in the Corona situation right now, we have decided, force majeure, that SZV has to expedite its automation process. It's something that you guys started when you were here, Rick is still here, but we need to expedite our automation process. So to be able to give myself that advice, I would have started that earlier if I had known. Started the automation process and pushed the automation process faster. COVID pushed it for us. So my advice to myself would have been faster with the automation process, more communication internally, more communication externally.
Dennis?
Well, looking back at where we started, and that was only for about 2 years in that period. And in that period, we had to take over the whole functioning of a social insurance situation. We were obsessed with naturally trying to get it right and do it the right way. And one of the things I believe I would advise myself, looking back at that period, would be just a better communication to the outside world of what was happening. That didn't happen. And naturally I could use the excuse we didn't have time for that, or the capacity in the sense of people to do it. But still, it would have been wiser if we had to be embarked on a more open communication towards the clients of SZV. That is the advice I would give myself. I would say you put that in a corner, but you should have taken it up and put it up front. That is what I would have advised myself.
Okay, I have to go back to before 10 because at that time we took a back seat, and we don't know what's going to happen. St. Maarten's going to decide what's going to happen with regards to social insurance and so on. And I think at that time I would have, if anything I would have changed, is I would have been more proactive in advising government which direction to go. Because yes, we made it happen with all the issues that we had, but it maybe could have helped us on the way and the transition, to make the transition a little smoother. If anything, that would be the first thing I would have done, to be at least maybe a year or two before, start advising local government as to which direction we believe would have been the right direction for St. Maarten to go. And furthermore, it's the communication. That is something that it keeps coming back. That is central. Glen said it. Dennis said it, and this is something that up to today we are still seeing, that communication. No matter how much you do, you always have to keep on communicating more, because we have a change in society. So not because we tend to say, yeah, but we announced it last year. Yeah, but this year have new people start working, have other groups of people, have people who coming from abroad who start working. So the community changes. So you have to. It has to be a continuation of information.
Yeah. I think that's one point we definitely also agree upon is communication internally, don't forget that, and externally, as I call it, communication and education.
And what I think is very important, we have to decide as a country together what quality of healthcare we want here on the island. Because sometimes you get the impression that we want to have the Bentley kind of service, but we want to pay the price of a bicycle.
But isn't that Ricky, because we are a small scale of inhabitants? What's our total insured population at the moment?
Well, right now, for if you combine all the sickness insurances that we manage, we're talking about most probably 37,000, maximum 38,000 thing. But and going to the point of the scale, listen, it has been proven many and different documented that for you to have a good insurance to be able to survive and be able to do everything that you have to do, we should be talking about 200,000, 250,000.
But that's exactly the challenge. The challenge is that because we have 37,000 people, of which now less are paying premium, but you still have to treat that. That is the challenge we're having. And again, these are discussions that we're having with the government on how we can do that. Because at a certain moment, when we were under the Netherlands Antilles, we had the Curaçao population, actually the entire Netherlands Antilles population, of which we were not. We had the younger group, and that's why we had all the millions, like you mentioned. Yeah. But as our population is getting older, living in their 70s and 80s, but need more medication, the amount of people that are contributing to the coffers to be able to carry the healthcare of everyone becomes more challenging.
Everything is in matter. But we should be able to do more in Sint Maarten. In the new hospital, of course, we're going to be able to do more. But if we have, like Dennis mentioned, that since the beginning of SZV, we were talking about telemedicine. If we make use of telemedicine, we have more for specialists, although they're not established here, but that they can come here instead of having to send patients abroad. That will also help, because again, treatment closer to home. That is our main goal, to have people to be able to stay right here and get a treatment.
But for that to work, two things you have to get rid of it. Get rid of the bureaucracy. We send patients to Colombia, but still we cannot bring a Colombian doctor to Sint Maarten. If the law does not permit it, change the law. So we really have to work on these things. And that is where we need the government, civil servants, everyone to work together in the same goal. Because some things just don't make sense. Yeah. Some things just don't make sense. And again, we know the issues, we have the answers, but we as Sint Maarteners, citizens of Sint Maarten, I should say, should work to tackle them to get to those solutions. And that is one thing that SZV is embarking on. And again, Dennis, is something I think we should be proud upon. We are automating so fast in this organization. Through the automation of SZV, we were able to do the SSRP. Through the way we're doing now, we will, in the future, very soon, no one will be needing a card anymore. You just use your ID card. Everything will be online, portal. You'll have My SZV. You have the own portal for businesses. So this is something that we are pushing fast enough so that we'll be able to give that additional service to our customers. Yes, there are certain customers who are not computer savvy or don't still want to come here and do that. Yes, that will take a while to have that transition from the older way of thinking into the more modern way of thinking with the automation. But SZV wants to be the trendsetter of automation, online, apps with your phone, everything done especially for our newer customers. "10 years from today, I would like to see the eSZV completed, but the eSZV together with e-government. We do not want to still have SZV so automated, but still you have to go to another institution to get a paper stamped, or to bring in a receipt, or to email us a receipt. We would love that e-government plays a tremendous role where actually from your smartphone you will be able to get everything done when it comes from a governmental perspective, and that SZV is tied into that. Totally service oriented. That when someone sends us online information requested, that we can answer them back within a few hours. That is where we want to go to. That is what we actually are working on to go to. Also, as I said before, prevention. SZV wants to drop the cost of healthcare by spending time and yes, money into prevention. We believe that if SZV assists government and other stakeholders in prevention, we can drop the cost of having to send people abroad because they're sick. It's going to take everyone. SZV can't do it alone. It's going to take the stakeholders to participate. It's going to take understanding. It's going to take discussions. It might take some arguments. But at the end of the day, like what we have done always, when we are down and out, we always come back up, and we will be able to solve these problems. So that is where I see the SZV hopefully within less than 10 years.